I like.
Oh, this?
Supervisor Lund, can you hear us all right?
Belgian. I've got a lot of good players.
Sir, can you hear us all right?
Bigger rock since you can't roll them.
No, it's kind of. I have to.
What? No, it's wording.
Have to have on the case.
Rose, can you hear us all right?
So then
Thank you.
I gotta have ESPN.
Roger,
Because
forget
otherwise-
about tonight. Roger, he usually doesn't control in that like public hearing.
Yeah.
I was told we didn't need a report. I can understand. So I was just charging it. I love it. I don't have many friends. Get all this meeting to order. Roll call by the county clerk.
Nobody cares. Nobody knows. Nobody cares. Absolutely not.
Yeah, but, Audrey, could you just mark me present? I forgot to fire up my thing here. Okay. All right, thank you. Thank you. I promise you I'm here.
We have 24 present and 6 absent.
Pledge of Allegiance. Mr. Johns.
Mr. Chair, thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible.
Just a quick moment. Thank you. Have it. Please be seated. Certification of compliance to open meetings law.
Your compliance, Mr. Chair.
Thank you, Mr. Waymeyer. Approval of the agenda. I'll entertain a motion to approve the agenda as printed. So moved by Supervisor Schultz. A second. Second by Supervisor Falker. All in favor?
Aye.
Opposed? Hearing none. Move on to communications. Any communications? None. I'll next move to public comment, which is a bit redundant since we're opening up for a public hearing and the only thing on the agenda right now is the budget. So is there any public comment? No. Okay. Item 7. Mr. Jones. I think it's Dick's.
Not that good looking.
I know I'm at least in second place. I move to open the public hearing on the 2022 recommended budget. This is a public hearing required by state statute.
Do I have a second? Second by Supervisor Jekyll. The public hearing is open. Any questions or comments? Questions or comments on the budget? Calling once. Supervisor Martin?
Thank you, Mr. Chair. Could someone just refresh for me where we would find the anticipated expense for the consulting fees for the strategic plan for 2022? Thank you.
Mr. Waymeyer.
It would typically carry over to the general revenues and expenditures, and we have shown that as a carryover process in the budget. So we don't necessarily have a specific number identified in the current year's budget, but we're using the carryover strategic planning dollars that were carried over into 2021, which will carry over to 2022, pending board's approval in March of 2022.
Any other questions, comments? Thank you, Finance Committee, for doing a great job.
Well, thank you, Mr. Chair. I move to close the public hearing.
Second.
All in favor?
Aye.
Aye. Opposed? Hearing none, it passes. Annual reports. Human Resources, Terry Palm. Oh, God.
This was going to be a short meeting, so I thought I had like all this time in the world.
You want me to time you at 3 minutes?
I mean, really, I got all these notes. No, seriously. So in front of you tonight, you should have, hopefully, my annual report that covers 2 years, 2019 and 2020, since we didn't do it last year. And really what I wanted to focus on tonight presenting to you is more of the challenges that HR faces. And there's some that are just nationwide. Probably the top one when you ask anybody is retention and recruitment of staff. I think if you look at our past recruitment over the years, we have fewer and fewer applicants that come in, and even fewer and fewer qualified applicants that come in. And then trying to retain those staff, especially if you bring them in and you need to train them to get them up to speed, and then they go somewhere else. And it's not always about the money or about the benefits. So working on what are those things that we can do to keep people here. The other big thing, and I mentioned this last year or in 2018 or 2019, is looking at succession planning and leadership development, and you'll see a big part of that in the report also. We do have over 41% of our current employees who are eligible to retire today. That's either with a full retirement or some form of partial retirement or reduced benefit through Wisconsin retirement system. Obviously, I think if health insurance ever gets figured out, you'd see a whole bunch of people doing that, but people stick around mainly for our health insurance. So going on, hopefully this works from here, or I'm going to have somebody click the button for me. It worked earlier. Sorry about that. Grab my laptop. Otherwise, then I just get to talk. You don't even have the visuals. Anybody else stop the share or no? Yay. So I'll pick up where I left off. What I would really want to talk about is maybe some of the other challenges that we have faced recently in 2020. And that is a significant increase in employee and health and wellness concerns and increased absenteeism. And what have we done to do this? And I think almost everybody here knows one of the things is we are looking at policies continuously. We've created them, amended them, suspended them, reinstated them, and kind of repeat the cycle over and over depending on what is going on in the world. Some of these things have been pretty common sense starting back in March of 2022. If employees feel sick, stay home, don't come to work. That should have always been the case. There's some new things, and this is just really just not everything that we've done, just a few examples of things. But implementing virtual meetings. You'll see tonight we still have people that are virtual. We do that continuously even in our workplace. We've eliminated unnecessary travel, and we are back again letting people travel. Now, whether that stays with what the states or the federal government does, that's a different story. We tell people avoid crowded areas, no more potlucks. So we've been, cutting back on those kind of things. And probably the biggest one is just talking about remote work, the telecommuting that we have. With telecommuting, for those that you have been around, prior to 2019, we were in the midst of developing and revamping our whole personnel ordinances. And one of the topics in there was remote work telecommuting. Back then, sounds like so long ago, we really didn't think that was going to be a viable option in most cases, but we were kind of forced to try it, and in most cases, it seemed to work. I would say probably 95% of the time. The biggest challenge from people when they were telecommuting was probably bringing people back into work, but I would say that was the very minority, maybe 5% of the employees. But there were things that we had to do with the policies with this. We had to make sure that employees were working safely at home. How are we going to make sure that they were accountable at home? One of the jokes that I saw on, looking up for some information on jokes, which I didn't do, is, if you have somebody with a cup at home, the joke was, just make sure you blow in it and wave it like it's hot while you're drinking your wine, pretend it's a glass of tea or something like that. So how do we make sure people are accountable? How do we make sure they're getting the supervision needed from employees? How do we make sure that the workload distribution is equitable? We have some people at home, some people back in the workplace. How do we make sure those that are back in the workplace, meeting with those individuals face to face, are still able to get some of the other work done because they're taking that on for other people? And then, of course, one of the biggest challenges we have a number of positions that simply can't work remotely, and some of the inequity or unfairness that individuals may feel on that. So, like I said, did it work? I think for the most part it did. From March of 2023 through 2020 through May 21st of 2021, we had at least 224 employees working remotely at some period of time during that span. And do we think that it can continue to work? Well, right now we are operating under a policy where we allow people to telecommute. It's more specific, I would think, than it was a year ago, where there are basically three options. They can telecommute ad hoc. Maybe there's a snowstorm coming and they know that they can't make it in the next day, but there's stuff that they can do. Or there's a special project that just might take a day or two and uninterrupted at home, they might be able to get it done. Or they indicate that they want to work short term, less than 3 months. Maybe somebody has a knee surgery, they can't walk, they can't drive to work, they're off of medication though, they're able to function where they can work at a computer. That might be in a scenario of that. And then we have the long-term kind of cases. We don't have many of those, but there are a few. An example of that might be somebody who's contracted. One that comes to mind is an emergency help individual right now contracted for a very specific project where all the work is done from home. There is no face-to-face contact with any members of the public other than the direct supervisor. So since we did this in August of 2021, we do have 204 requests to telecommute. Like I said, it's not that everybody's doing it every day. In fact, there's very few people that are doing that. We have put into place, we've had it in place, but it's more robust right now on how to track that. So hopefully a year from now, I'll be able to provide some data back for HR committee and the county board just in regards to how that's working, how many hours are actually being done by remote work. Some of the other considerations that we've had to do is more flexible work. We have our voluntary furlough plan, we suspended that rule. It was maximum an employee could take voluntary furlough, which means voluntary unpaid time, before they use all their accruals up. was limited to 40 hours in a year. We increased it to 120 hours, then we extended it beyond that, and now we're back down to the 40 hours. Then there were a couple of laws that were put into place. Everybody probably is getting sick of hearing this, but the Emergency Family and Medical Leave Expansion Act and the Emergency Paid Sick Leave Act. These were federal regulations that went into place that were mandatory to follow, paying individuals if they needed to be out for daycare closures because their kids couldn't go to daycare, if they were in isolation or quarantined, or if a family member was isolated or quarantined. So this, I found it to be a very interesting fact. Those running a report, I mentioned before, people had 40 hours a year that they could do voluntary furloughs. In 2019, it was 586.75 hours countywide. 2020, 2,905.75 hours, a significant increase. One thing I was going to mention about telecommuting, the other thing I came across was in 2020, the use of sick time was way down. I don't know for sure. I got to take a little closer look as far as was it certain departments versus not. For example, highway and the sheriff's department can't telecommute. So was their sick time about the same where other people were down because they're telecommuting? Individuals might, normally if I have to dentist appointment, I'm going to take 4 hours because it doesn't pay to come back to work. Versus although they shouldn't be taking all sick time for that, versus if I'm working at home, I run to my appointment, I come back home, and I go back to work. So I'm going to dig into that a little bit, but I found that kind of interesting too. From April of 2020 through December of 2020, when the first round of PSLA and the emergency FMLEA went through, we had 7,600 hours, and you can see the cost there, 135 people utilizing it. Remember, these are people either quarantined, in isolation, maybe a daycare closed. And then it was extended in April of 2021 through September of 2021, and it was expanded a little bit. It also included for employees who wanted to go get vaccinated, or if they were sick from being vaccinated, had to take a family member for the same thing. During that time, we had a little bit over 1,700 hours, $52,000 with 92 employees. I will say the majority of that are for people that were going off and getting vaccinated. So it was only an hour, 3 hours at a time. Very few of those individuals were counted under the isolation or quarantining. And this, I thought the board might be interested in the total cost, the total hours, with the, it's also including the voluntary furlough, so there's no cost to that, but no direct cost. You still have the lost productivity and overtime. Approximately $248,631. Now that has all been in some form or another, I'm looking over at finance, hopefully they're directly reimbursed or through tax credit, so it's not a direct cost to the county. And then just something on the radar right now is future policies to consider. You may or may not have heard there is an executive order right now. We're trying to figure out what exactly it means. There's different parts of it. I'm just going to highlight 3 that may or may not impact the county. The first is a mandated that employers that have 100 or more employees, now this is private sector, need to be vaccinated. If they're not vaccinated, they need to have weekly testing. Now there are, because this is going to be governed under, or the rules under OSHA, if I remember right, there's 26 states that probably will fall under because their state regs say we follow OSHA. Ours is very similar in Wisconsin, but from what I'm reading, we're not exact, so we're kind of in limbo. I don't know if this is going to apply to state of Wisconsin, local government or not, because like I said, this is specifically for private sector. The second is mandatory vaccinations. This is have to be vaccinated, not just the option of testing for healthcare workers that receive Medicare or Medicaid reimbursement. Now, obviously, we know Human Services does that. Looking at all the definitions, it doesn't specifically say Human Services, but it doesn't specifically exclude them either. So who would it include in there? If any, I would almost think if it's going to include, it's not just your healthcare workers, but it's going to include anybody who's getting funding for their positions. And the last one, which I think is probably the least to worry about, but not completely out of the radar is vaccine mandates for federal contractors. Sheriff's Office, Highway Department, if you're doing any federal contracting, if we would fall under that or not, that you have to be mandatory vaccinated. And then, as I like to put in every job description, all other duties is assigned, because this is really what a lot of my job was and our HR department was, is we worked with the public health department, with emergency management, a lot of it with PPE. So I'm just not going to read all this, but I'll put it up there real quick. These are just some of the fun things I had to do as far as ordering some supplies and storing them, which for a long time was in my office. So, and then the final perk is just something to add to my resume. One is I became a respiratory fit tester. There's myself and 3 others. So if anybody wants me to demo and you want to stick around, I'm not saying stick around, I want to spend another 20 minutes in front of everybody, I'm happy to fit test somebody with a N95 respirator mask. Some of them are really pretty. They're orange. They look like a duckbill. And then did anybody want to do that? Spend another 20 minutes here? And that's only if you get it right the first time? Okay. I don't wear the hat. The person being tested wears the hat. Steve, step on up. The other is, like I said, professional shopping negotiator. Like I said, I came across some great places to make deals, to get especially syringes when they were doing vaccinations. So it was a lot of fun. One of my favorite things shopping for were these plexiglass things, because they come in huge, huge boxes. And, there's nothing better to do with these big boxes than to recycle them in the best way. So just a little HR humor.
Expense, expense.
It is, right? I'm not sure if I'm going to make this work or not. That's a high rolls. That's a dad joke. That's an HR joke. If you guys don't get it, I'm sorry. I tried to do the little boom boom here. So I just wanted to see Ben sweat a little bit on this. So if there are any questions that I can answer now or afterwards, I'll stick around also.
Do we have any questions for Terry?
See, nobody fell asleep.
Yeah, good, good.
Much more than my 3 minutes. So
Thank you very much, Terry.
I
Keep
gotta
up the
stop
work.
here.
Thank you. Our next annual report will be done remotely. Health Department, Gail Scott.
Hi, good evening, everybody, and thank you for giving me an hour and a half, because your meeting is so short tonight. I want to first thank Terry. I think she was far too humble on all the work she did during COVID. She absolutely was an honorary member of the health department, and she was able to help us not only with all those PPE supplies, but to help us staff our clinics. So she did that. And on top of that, every time we needed some more staff, or we needed to increase or decrease staff, Terry was right there by our side. So I thank her. Thank you again for giving me a few minutes to update you on the health department. It's hard to believe it's been 2 years since I've addressed the board. I will just touch briefly on 2020, and that is the only report I produced, because I wasn't ever sure when I was going to give this report, and then tell you a little bit about what's been going on in 2021 and what's ahead for 2022. First of all, I just have to thank the health department for their dedication and the tough work that we've been doing during the last 2 years. Long hours were the norm, with many Zoom meetings, thousands and thousands of calls coming in to mostly my 2 office staff, and sometimes other people jumped in to help as well. They also answered a bazillion emails. It seemed like they would just never end. And we set up email boxes for the schools, the businesses, the long-term care, the general public, and on and on. The staff did an absolutely incredible job. And I know often we say that, but these last 2 years, I really truly mean that. In December of 2019, we started hearing about this funny virus called the novel coronavirus. I remember meeting with Ben Waymeyer, Terry Palm, a couple of our nurses, and Elizabeth Tilson, our public health program manager. And Ben asked me, "Is this the big one?" And I said, I think it might be, and I think we better plan that like it is the big one, because this disease was very different. It had a lot more, or it was much more easily transmitted and a lot more morbidity and mortality. So in 2020, in January, we met, as I said, and we started planning. Our first case actually came in on May of 2020, and we never knew that we were starting down the journey that we've walked up until today. We also saw on November 6th a record high of 125 cases in one day. And I'll never forget when we got 2 cases in one day, and the staff were very overwhelmed by it. And Summerose just corrected me. Our first case came in March of 2020. On November 6th, again, we had a record 125 cases. The morbidity and mortality rate in the beginning was highest in the long-term care setting. And one of my friends contacted me on a Saturday morning and asked me if she could help. And she is a very well-known long-term care nurse in Jefferson County. She's worked a long time in in different facilities. And I said, "Boy, do I have a job for you." And we hired her as our long-term care consultant. And that was really one of the best things that we did. Along the way, we tried to be nimble in our staffing patterns and organization of our department, establishing different teams for disease investigations, contact tracing, schools, businesses, child care providers, and organizing into an incident command system structure. One day we joked that we were reorganizing our department almost every day because that's how fast things change. I included the stats in the annual report for 2020 and have the current stats available on our dashboard on our website. So I won't go over all the stats because then you will be here another couple of hours. To date, the health department has provided over 17,000 COVID vaccines, provided at well-organized clinics, and also set up with the incident command structure. Little did we know when we all took those classes how important that structure would be. It was staffed by the health department and around 500 volunteers. That included other county department heads and staff, doctors, nurses, dentists, EMS workers, School of Nursing students, a team called Team Rubicon, which are veterans who pick a place, a disaster to help out. And they picked us, and they did our parking and our control through the clinic for us. And we also had many, many people from the community. We had wonderful support in the beginning from Amy Listow and the County Fair Park, and we were able to vaccinate over 1,000 people a day there. We also coordinated testing and vaccine sites throughout the county and provided leadership throughout the pandemic, including the establishment of an emergency operations center and provision of guidance. And little did I know when I first met Mr. Waymeyer, and I learned of his experience in the military and talked to him and knew right away that he was a born leader, how very, very important he would be in assisting us in this pandemic response. I can't begin to thank everybody who worked with us throughout the pandemic response, including those listed on the dedication page of the 2020 annual report. Our medical systems were just stellar in their support and their communication with us. A shout out to Donna Hogan, Director of Emergency Management, for her assistance with logistics, getting PPE out that Terry bought or that she got from the state to our long-term care facilities, emergency responders, and others. And she also is assisting us with our testing sites. Again, a big thank you goes to Mr. Waymeyer for his leadership and to all my staff, who I named the Dream Team, for their incredible hard work, and their wonderful leader, Elizabeth Chilson, our Public Health Program Manager, and all the help that we got from our epidemiologist, Sumrose Jack Bonney, who took on so many duties. This week, Jefferson County reached the 50% mark for people fully vaccinated. 52% are partially vaccinated, with a total of 70,366 doses administered to Jefferson County residents, and that would be doses we administered, doses that people got at pharmacies and throughout the medical systems. And there are 6.5 million doses that have been given to Wisconsin residents. It is important for all of us, as Terry said, to continue to be safe, get vaccinated, and keep informed. We are seeing the number of cases plateau, although this weekend we did have over 40 cases come in. And the highest number of cases are in our 0 to 17-year-old age group, with the lowest number of cases in our 65 plus population. That's our most vulnerable population and also our immune compromised. You will be hearing a lot more about booster doses and extra doses, and I will not go into that tonight because that would take probably 2 more hours to explain. But it is important that we think about our most vulnerable and how to protect them. We've had over 3,000 cases reported this year and 45 deaths just in 2021. Again, for more information about cases, vaccines, booster doses, expanded age groups for vaccine, please see the Health Department website. For 2020, we ended up with a budget surplus, and we should have a surplus in 2021. Even during the pandemic, we were able to continue our priority services, including following up on all other reportable communicable diseases, human services, mental health, nursing, our children's safety program, and the provision of car safety seats and cribs, childhood lead poisoning prevention program and follow-up, our women, infants, and children program, or WIC, continued, with some of the being virtually, which was allowed by the federal government, our WIC Fit Families program, our WIC breastfeeding peer support counseling services. We continue to work with Head Start for nutrition and health consulting services, promoted our farmers market nutrition program, continued to give childhood immunizations, and also continued our public health emergency preparedness program. And talk about dumping a large amount of work by having one of the biggest fires in the history of Jefferson County in Fort Atkinson, right in the middle of the pandemic. And we were able to respond to that with emergency management and with all the emergency responders. We also brought in the State Department of Health Services and the Environmental Protection Agency that monitored the air and water quality coming off from the fire. All in all, it worked out very well, not for the people that lost everything in the fire, but our air and water quality remained pretty safe throughout the fire. We continue to meet our grant objectives and keep our staff trained in the incident command system. We continued attending all exercises and meetings with our South Central Wisconsin Healthcare Emergency Readiness Coalition and continued to work closely with emergency management. In fact, we had an exercise with them today. We also continued all of our environmental health services that we contract with the City of Watertown Department of Public Health, and that included all our inspection and licensing of our facilities, beach water and transient non-community well water sampling, and follow-up on human health hazards. And then we knew it was very important to continue our Jefferson County Drug-Free Coalition because we know that substance use has gone up during the pandemic. So what's in store for 2020? Well, we will continue all the programs that I just talked about, and we will be hiring a nurse to share with Human Services to work both in our clinic and in the mental health nursing program. We will continue to employ our epidemiologists to assist us with the unrelenting COVID-19 response and to update our strategic plan, which we have started in 2021, assist us with data and program evaluation. We received quite a large amount of funding for workforce development. We received state ARPA funding and immunization funding, as well as continuing funding for our disease investigations and contact tracing for COVID. So we will have funding to continue. Much of this funding, they encourage us to use for development of our workforce and for continued training and development of our staff. And it's also important that we work towards recovery because we know that this pandemic won't last forever. And we need to move on to providing our regular programs and services. Not that we're not providing them, but to get back to a more normal situation. We will take part with Dodge County and the City of Watertown in completing a new community health assessment and community health improvement process and plan. This will allow us to see where the needs are in Jefferson County and to prioritize program services and needed partnerships. We have already increased our office hours and we are open now 5 days a week for COVID, influenza, and childhood vaccines. We hope to continue our partnership with the Greater Watertown Community Health Foundation in providing programs for young families with children. So what's in the future? By now, most of you have heard that I will be retiring after 40 years of working at the health department. Another big change will be our business office manager, who will be retiring after 32 years of service. We had joked at last year's budget meeting that we would walk out together. And I jokingly call Sandy Shunk, who is our business office manager, my brain. Sandy actually has a Gale folder, and in that folder, she has a reminder of everything that we need to get done and accomplish. And over the 32 years, 31 of them, I have been the director. We have not missed a deadline. We have not missed submitting a report. And we have never let any money go without maximizing every single grant that we have gotten over the years. Sandy and I work very diligently together to make sure that we maximize every penny and that we do it correctly. And therefore, we have passed every audit and every state assessment. And I just can't thank her enough for the wonderful job that she has done. And now that this is becoming a reality, I look forward to seeing the health department thrive. I have told the staff that they should not do it my way. They should not try to honor my legacy. They should do it better, and they can. And they can always call me. I will be glad to help, but I don't think they'll need my help. I think the health department is in great hands. Thank you for all your support over the years and the support from our Board of Health and the county administrator. and all the other department heads, on and on. After 40 years, there's probably 40,000 people I could thank. So thank you so much. It is greatly appreciated.
Thank you, Gail. Do we have any questions? Any questions for Gail? Seeing none, thank you very much, Gail, and good luck in your retirement.
Thank you, Steve.
Uh,
Bye, everybody.
Kevin Weissman is waiting in the wings here. Parks Committee, please. Thank you. Annual report.
All right. Little Birdie told me to keep it short and sweet, so I'm obliged to oblige. So, Mark, start your watch. Wanted to say thank you to everybody for having the opportunity to be here tonight. My name is Kevin Weissman. I'm here on behalf of the Jefferson County Parks Department. I am a long, long way away from retirement. So you'll probably be seeing me for 20, 25, who knows, maybe 30 years, if I'm lucky. So you guys have a copy of our report in your packet. Wanted to go over just a couple items in there to note some of our rentals, our fees, some of our other stuff that we collect. So starting with the dog park, Jefferson County has an amazing dog park if you've not been there. I have a young 9-month-old lab that's chewing my house apart, and the dog park is always a savior. I know it's by far most widely used park. We've broken records just about every year. We have more and more and more annual tags that we sell, more revenue that comes into the park. That's continued to be an extremely popular park. Our shelter rentals are right up there, even with COVID and a lot of the nerves of people coming in. We weren't quite at a point of breaking records, but getting close. And then our camping that we have, it's relatively new to our park system. We've seen an increase in our camping in our parks every year, and this last year was our largest jump to date. And as COVID challenged a lot of things, it certainly brought a lot of people into our parks and onto our trails. The last year and a half, we've seen by far the most people using our facilities, which has been, that blessing and curse, but definitely a lot of goodwill, a lot of positive things coming out of the community, a lot of positive comments. Something I wanted to talk about tonight specifically, one, Terry hit on this a little bit, but the importance of staff and the quality of staff that we have in our departments. And I feel very fortunate to work with people who are very dedicated to the mission, vision, values of our department. They're very detail oriented. They're there early every day. They'll stay late. They're in working 7 days a week to make sure stuff gets done for our shelter rentals, for our dog park, for all the facilities in the county. They're on call for snow removal. They do a lot of stuff, and I'm extremely grateful for the people that we have and hope that we're able to retain those people. And as folks retire and move on, that we're able to bring new people in. I know that's something that everybody looking forward is concerned about, is having those quality staff. But to date and ongoing, I feel very fortunate for the staff that we've had in our department. Another note that I wanted to make, just thanking all of the other department heads and staff at the county. I work with a lot of very talented people, and when we reach out and need resources, need help, need guidance, we have tremendous staff that are always there with a smile to help us make something happen. And we should all be very proud of that, of the staff that we have here, and that's from Ben all the way down. We have a great organization, and I'm proud to work here. And kind of in the end here, I wanted to open up our door and our department to all of you. I'm relatively new in my position to our department. Some folks have been on the county board for many years, some are new. But anytime you guys are in the courthouse, I'd really encourage you to stop in, have a conversation, ask questions. Maybe you love something we're doing, maybe you don't. I think it's just important to have those conversations and be able to get some of that FaceTime with you all, show you some of the resources that we provide, some of the maps and other stuff that we have in our parks. We'd love to have those one-on-one conversations with you. So anytime you're up and about, please do stop in. Other than that, life is good. We appreciate everything that the county has done. We have a beautiful, beautiful system of parks and trails. that really kind of rests in the decisions that have been made in this room to make that stuff possible. It's a new park system. A lot of people are getting to know it. We're getting more and more and more people into the parks every year, more and more use, becoming more kind of mainstay in our community, and we're seeing that support day in and day out. So thank you all. Hope to see you in our office someday. Stop.
Do you have questions for Kevin? Questions for Kevin? Compliments?
Thank you.
Thank you very much. Mr. Kern, Highway Department.
Hi, everyone. Let's talk about roads for a minute, huh? I think Kevin broke the cycle a little bit there. I was gonna say no more COVID. Let's talk about something else here. So let's talk about roads. So I'll use my time again. It's been a few years too since I've got up and spoke. So I thought what I'd do is just use my few minutes here just to talk about a lot of interest always in what we're actually doing for our road work, our projects, our paving. So I think I'll just go back and highlight a little bit the last few years, what we've actually got done. And our highway committee and our finance committee's heard a little bit of this, but just for the rest of the board, a couple of years ago, we took a kind of a step back. We looked at our system, what we'd actually accomplished over the last 10 to 15 years to see kind of where we're at. We kind of go off the cycle of asphalt pavements will last about 20 years. So we're trying to do a constant turnover of those roadways every 20 years. So we took a look back to say, are we kind of keeping up or not? Are we falling behind? Where are we at? And what we saw as we looked at it is we'd had some construction work to do over a few years, and it really we had to kind of focus that money a little bit more towards that construction program. And we fell a little bit behind maybe on some of our maintenance turnover of our highways. So looking at the program, we said, well, how do we catch up here? We got some roads that it's been 25 years, 30 years since we've actually touched some of those roads actually with a new pavement or a new construction project. And we looked at our program and decided to look at a way of adding maybe another layer of our work into our construction and paving program. So what we did is we went into our system and looked at it and found the roadways that were holding up really well. And we knew they were coming up on a cycle, maybe in another 7, 8 years, and decided to go into some of those roadways actually and do a mill pave project. So when I talk a mill pave project, I'm only going to go in and take the surface off that roadway. So we talked a lot up here about doing a reconstruction of a roadway, doing a rehabilitation of a roadway, pulverizing a full asphalt roadway, and repaving it. But in this case, what we're doing is kind of a glorified maintenance or a light construction project where we're just taking that surface off and putting a new 2-inch asphalt surface on that roadway. So doing that, it's a low cost way of actually gaining a lot more years on that actual pavement that we're actually out there trying to get life out of. So we added that into our program a couple of years ago, and I think I'll just run through kind of what it actually did to us as far as our roadways. You probably have noticed maybe the county crews out there doing a little more paving work in the last few years, and if you think that's the case, it is the case. So we've been a little more active on some of the roadways. So when I look back at our program right now, I'll jump back a couple of years. In 2019, we focused on that mill pave on one of our primary county highway roadways, is Highway B. So we looked at that roadway again as being a roadway that was going to be coming up in our program probably in 6 or 7 years, but it held up really well. It had a lot of construction work done on it over the last time it was done on a federal aid project. And we thought we could go in and actually mill it, put a new surface on it, and actually gain a lot more life out of that roadway and not have to come back on it again for quite a few years. And that'll help us get to some of those roadways we've actually been putting off for a while. So we took B and milled, paved the whole pavement from Dane County all the way to Waukesha County. That's the one that parallels the interstate, 23 miles. We actually did that all 2 years ago. As part of that same year, we actually pulverized and paved down in the southeastern end of the county on County Highway CI from 106 to Waukesha County. That's about 5.1 miles. So in that year, we actually ended up paving 28.1 miles with that large mill pave project actually and getting that up to speed. So that kind of got some new surface out there and put a lot of miles out there actually that we think was going to gain us a lot more years in our program. When we moved into last year, 2020, we didn't actually utilize the mill pave as much. We just done a small project, but we were able to actually do 4 projects last year. County Highway A near Lake Mills, where we actually had some construction work to do. If you remember, that's one we got delayed for several years, where we had to do some realignment work and buy some right-of-way. But we accomplished a mile on that roadway on a full reconstruction, actually realignment on about half of that roadway, actually. We actually did do a full pulverized pave on County Highway E, again, on the southeastern end of the county, from Palmyra to Sullivan. We did 8.3 miles of pulverized paving on that project. Jump up to near Jefferson here, west of Jefferson on Highway J. J was a road that actually had been put off for many years. We've been kind of looking at trying to go after it. We knew it was going to be a lot of dollars, so we got into a large construction project on it. But we had segments of that, or one segment that actually was over 30 years old. So again, this is a way to try to jump that up. We actually went in and did a pulverized pave, did some rehabilitation work on it, culverts, some ditching work, and got that project done. And again, one that was waiting for so many years, we got that done last year, and it was about 3.2 miles from 106 up to 12. And then the next piece of J from 12 to G, we actually did do a mill and pave on that project, actually kind of tied it all together with the new surface on that section. So last year we did 13.8 miles actually of paving work on our county system. And that kind of leads us up into this year right now, where again, we looked at our system. We knew we had some mill paves we actually wanted to add into our system this year. And we also had some large projects to get done this year too, but we actually found some extra funding. There was some of the money from a supplemental program for the state budget that actually funded $1 million last year or this year into our County Highway N project. So we went to N this year from Whitewater heading north here to Jefferson. It's 10.8 miles, so it was a large project, but with that influx of an extra $1 million of funding, we were able to get that all done, and that was all a pulverized pave project. We took N again from Jefferson by the Fair Park up to Highway B, did another pulverized pave project there for 3.5 miles. And then we were able to use some of that funding again that we wanted to utilize through some of our maintenance dollars, and we went over to F. And if you're in that area at all, you know we were just in there about a month ago, and we took the segment from the interstate up to Ixonia and repaved with a mill pave project, that 5.3 miles of that segment of roadway. And in part of that project too, we actually had a railroad approach area that was pretty rough in that area around Ixonia, and we're able to work with the railroad and get that actually improved and fixed and get that all done this year too. So, and now, right now, the asphalt is probably still cooling off, but we went down to Highway U down near Whitewater from N over to D and had a small segment, a little under 2 miles, that we were actually able to go down to just in the last couple of days and actually do another mill pave project with some funding that we actually saved from our asphalt prices being a little lower this year. And got another almost 2 miles actually of mill pave work actually done just in the last couple of days down there. So this year we were able to get 21.6 miles of actually pavement down in our county system. So pretty big accomplishment. Guys did a great job. And if I take that now and go back those 2 years and then this year, we got 63.5 miles of resurfacing work done in our county system. So a big accomplishment. It kind of matched the goal we were actually after, to try to speed up a little bit after we had some more bigger construction projects to get done in previous years. And that 63.5 miles actually is 25% of our whole county highway system. So it saw new asphalt surfaces just in the last a little over 2 years. So you'll probably notice that on the highways. You're out there on the highways, you're going to notice a lot of new pavement, a lot of new looking highways actually in the county system. And it's actually it's a nice technique we use. We didn't ask for any more budget funding for this to actually do some of these mill pave projects. We were able to actually do some substituting of some funding internally. We cut back. We used to do a lot more seal coating in our maintenance program, and you're not seeing us do much seal coating anymore. We actually were able to utilize some of those funds actually to kind of infuse into this mill pave program. And we're utilizing that, and then if we actually have any savings on any construction projects, we'll actually infuse a little of that money into trying to get some of these mill pave projects done. So as we go forward, we'll continue to kind of do this, but it's actually put us in a really good position. You know, really appreciate, as Kevin said, really appreciate the support from the board. The highway committee has always been great. Finance committee has always been great. I think they kind of understand what we're trying to do in our program, and anytime we can save money, as we told the finance committee, we're going to try to put it back in the roadways. You know, we want great roadways. We try to be as efficient as we can on the winter side, because we want to put that money actually into our county highway system and improve the system whenever we can. So we'll continue to do that. I'll wrap up there. I'll just say one other thing. You know, things have gone great at the highway department. There are challenges, though. I'll tell you, looking forward right now, we're seeing some headwinds that are pretty tough right now. Everything we deal with our commodities, with our equipment costs, our truck costs, steel, and everything is shooting through the roof in costs right now. So we're really looking at some cost increases that are going to be pretty major all across the board for our department. We're looking at 20, 30, 40% increases on a lot of things that we have to have and we utilize in our operations. So it'll be a challenge. We'll just take it head on and deal with it. But it's It's not good. When I sat in my office today talking to one of our truck salespeople dealing with the trucks we buy for our plow trucks, and they said if I actually went out to a bid right now on plow trucks, they couldn't give me a bid. They said that there's too many unknowns. Our manufacturer just told us in the last week that we're putting a hold on bidding right now because we don't know if we can get the trucks. We don't know when we can get them. We don't know how much to even price them at right now because the costs going up so fast. So it's a pretty weird position to be in when we were just talking a month or two ago about delays in buying equipment and trucks. And now we're talking about major vendors telling us they may not even bid on stuff right now until this stuff gets sorted out a little bit more with the costs going up and the shortage of supplies. So it's a challenge. We'll deal with it. But again, I really appreciate all the support from the board.
Questions for Mr. Kern concerning highways, roads? Any questions?
Mr. Chair, there's one on chat from Supervisor Drana.
Supervisor Drana.
It's what's the plan for the approach for I-94 at County Highway F?
The approach, I'm not sure what, as far as the ramp or?
Supervisor Drana, you want to talk about that a little bit more?
Can you hear me?
Yes.
Yes.
Yeah, the approach, it stops just on County Highway F, just prior to the interstate overpass, is not completed. What's the plan for that? Either side.
Yeah, DOT is actually doing the improvement on the interstate, and they're doing several of these ramp improvements also. So the DOT is actually working on that through the contractor actually to get that ramp work done and that interstate work finished up out there.
Is there any plan for a roundabout at that interchange?
At F? No.
Okay, thank you.
Supervisor Christensen, you had a question?
Yes, actually, I have a comment. What I wanted to say is, as a town of Koshkonong supervisor, we've had several occasions where we could use some advice on our road work. And for myself, I've gotten help from Ann and Alice in the office, and also from Sean Heaslip and Brian Udovich. So I want to thank your department for extending your abilities out to the towns. Thanks.
Thank you.
Other questions for Mr. Backman?
I just want to second that. I'm with the town of Jefferson and Curtis Mill. You know, the county did that work for us, and they've always been there, and they've been great to work with the towns, and your shop should be applauded for that.
Thank you.
Other questions, comments for Mr. Kern? I have one. I thank you so much for getting County A done. I've heard about it. 22 years I've been on the board, been trying to get something done there. I have my constituents come up and tell me, A looks great except for that 1.5 miles in front of your house. You've been a county supervisor for 20 years and you just can't get anything done.
See what happens when you become a chairman? You get
Some chairman gets done. So thank you very much.
Now we see how it works.
Okay, that takes us to public comment of a general nature. Anything? Mr. Smith?
So I'll see if I can keep it under 3 minutes.
Okay, 3 minutes you got.
I just want to go on the record as saying, 98% of what I think this board does is a great job. It's the 2% that gets me driving around in my car screaming and not sleeping at night. And for the record, I believe there are members here who do a great job and are a benefit to the county. I found the castle discussion a waste of my time, both this board and my time. I ask a favor to zoning that in the future, when somebody comes there and something does not fit the criteria that we have, you send them on whatever this path is that you wanted to send the castle people on after we send them down this giant dead end. That Diane was my source to this. She came to the county and it was zoning who recommended the path of going down agricultural tourism. So I have to believe her. That, I found this whole discussion a waste of time. We do not want to reject your rejection, but at the same point, we need some people who step forward to say, this is the path forward. And to me, it would be similar to somebody having a corn maze that's just a giant end to the back of the corn, and it's just one way to a dead end, then it's a dead end corn maze. So, it's just a giant waste of time. Now, I want to be sure I've got my facts straight, and everybody's got a microphone in front of them, so please feel free to interrupt me if I'm incorrect on anything that I'm about to say. That I would like to bet anybody $1 having to go to the parks. If anybody would like to bet that interest on bonds are not going to go up in the next 3 years. Does anybody believe that? We were told we expect it to go up 0.75%. Does anybody think that they're not going to go up? Okay. Does anybody think, or does anybody want to bet $1 going to the parks that when we get next year the cost of the courthouse, that is going to be $35.8 million or less? Because I certainly believe it's going to be more than it was. After we had the vote for the $5.8 million, within a couple days I did some math, and I expressed concern about what we did to our administrator. Can anybody else say that after our vote you were concerned with what we did? Okay, nobody? I need someone to explain to me how, after I expressed concern and the finance committee went to $8 million instead of the 10 that I recommended, how the decision that we made was the correct one. We left $2 million on the table. We could borrow that money today for 1.48 or 1.5%, where in 3 years we would expect to pay 2.25% on it, which, as I do the math, that $2 million is going to cost an extra $200,000 in interest. So I'm at a loss as to how having the taxpayers pay an additional $200,000 in interest is going to save anybody any money. Can anybody explain that to me, how the more you spend on the cost of a loan that it saves you money?
3 minutes is up. Thank you.
Okay, thank you.
Anyone else?
Well, I'm not done yet.
Yes, we had 3 minutes.
Okay, well.
Actually, I'll let you go 3.5.
Okay, well then, thank you.
Yes. Anyone else? Anyone else for public comment? Anyone else? Seeing none, I'll entertain a motion for adjournment, or announcements, excuse me.
Just quick reminder, since we have a fun schedule coming up. So tomorrow, we sent out the maps for everybody. They are on the website, but there's been some tweaks from the proposed tentative plan for redistricting supervisors. So the executive committee will review them one more time tomorrow before those are finalized for the public hearing purposes, which will be next Wednesday at 7 o'clock. They'll be offered in person and via Zoom. That'll be the final public hearing on the final plan for redistricting. For the most part, every community has approved their plans as well, in terms of their wards, with the exception of one, which we hope to have done by next week, and that's Sullivan. And then those are the main ones. And then just a reminder, November 9th is our budget hearing. And so the reminder is next Monday, November 1st, right? That's the first? Next Monday is when amendments are due to my office by noon if you have amendments. Thank you.
Now I'll entertain a motion for adjournment.
So moved.
Moving second. All in favor?
Aye.
Aye. Opposed? We are adjourned. Thank you. See you November 3rd, Wednesday, November 3rd.